And this information is just showing you how representative that sample was of Iowa families. So the column that says sample is who was in the family survey, and the column on the right is representative information from the birth cohort to show you how this maps out. And what you see here is that we have a large portion of families from our group that would be below the 200% federal poverty line. So families of four making less than $50,000 a year, for example. We also have overrepresentation of families with children with disabilities. And these two populations were deliberate because we really wanted to learn a lot more about families that may be struggling in our system, that we need to think about connections. The pie chart you see on the right side shows you the work status of families, and we see that many of these families that we surveyed were working full-time, 15% part-time, a few students, and 14% were stay-at-home parents. The fourth piece of data that we collected was a provider survey, and this was 591 licensed center-based providers who participated in an online survey in the spring between April and May. We had a 46% response rate, which was pretty high. We were pretty excited about that. What we did was we took the list of DHS licensed centers, and that's where we started with, and we excluded folks that were only before and after school care to really try to get at those full-time centers that are open morning, afternoons, evenings for families to provide full-time care. And this is just a picture of how representative that group was. We had programs responding from 93 out of the 99 counties across the state. A majority of our programs, which we kind of knew going in, provide services to preschool or both preschool and toddlers, with a few programs, providing services for infants and toddlers only. And we were very excited also to see when we got our responses that these programs were representative of all the different types of programs we have in the state. So in other words, when we looked across QRS ratings, for example, we had about the same percentage of participants across each of the different ratings. So these findings are not weighted by only our highly rated programs or our lower rated programs or only programs serving preschools. They were representative of all the centers across the state. Another piece of information we collected were focus groups. Now this was really exciting because this was a really clear strength of ECI and the networks that local ECI boards have, because the ECI boards and the local folks were the ones that recruited and hosted these focus groups. And we did focus groups with families as well as focus groups with providers, really trying to capture what are families' experiences in the system, as well as what are providers' experiences and where do we see gaps. We specifically wanted to make sure we targeted and included families from traditionally underserved populations. So parents with children with special needs, minority families, non-English speaking families were targeted or included, not necessarily targeted, but definitely wanted to make sure that they were included. For providers, we also wanted to capture the broad range of birth to 5 programs that we had. So we specifically invited folks from childcare homes, centers, preschools, healthcare programs, early access programs, children's mental health partners, dental programs, home visiting partners, to really try to get a rich set of feedback from our provider group across the birth to 5 system. And the last piece of information was a reanalysis of data that was collected in 2018. We have some partners here at Iowa State through Extension and Outreach that worked across all 20 of the Extension and Outreach communities to do 62 listening sessions to really try to understand. The main purpose of the listening sessions was to say, what are the specific issues that are impacting Iowa and your region and affecting your ability to thrive? And one of the surprising findings, I think, for folks, even back in 2018 when they'd finished this, was that childcare was one of the top 5 that was identified in all 20. There were not targeted questions asking about childcare, and yet this was one of the main priorities that popped up. And so we said, maybe we should look more into these data and see what could we learn? What else is in these rich discussions that communities had? So we asked our partners in Extension and Outreach if they could reanalyze those data so we could learn a little bit more about that. So that's what we've been up to for the last 6 months. And now I want to share with you a little bit about a really unique opportunity that was created in July, where we had learning sessions with stakeholders who were invited to 2 full-day sessions to take all of that data that we collected and analyzed and organized into themes and talk about it, and talk about it some more, and look at more graphs and more charts and talk about it some more. And then we'd come back and reanalyze the data again and provide some more information. So it was really a point to try to have some two-way conversations about what the data are saying, how do we understand it, and how can we then turn the data into some strategic planning priorities to continue to move the ECI system forward. So what you're going to see for the rest of our presentation are a summary of the findings, including what bubbled up as some of the most important types of information that came out of these learning sessions. And how we organized these were what we called data dives. Super nerdy, I know, but it was really fun because we wanted to do more than water ski, which is what we have time for today. But we really went deep. We had handouts and tables and graphics, and we were going back and forth with the data across 5 different topics. First, who are Iowa's children? Who are our underserved populations? What do we know about access to care? What do we know about quality of care? And what did we learn about workforce and professional development? So now we're going to go through each one of these and spend between 5 and 10 minutes on each to give you some of the highlights and show you a few of the most interesting graphics and charts that came out of this work, so you can understand where we're at with our needs assessment to date. So just a teaser. We wanted to share with you some of the high-level findings from each of these sections. So when we look at underserved and vulnerable populations, some of the main things that popped out, the main groups of underserved and vulnerable populations that became evident were our minority children, those born to moms without a high school education or single moms, those born with inadequate prenatal care or just above poverty, and children with disabilities and health needs. When we explored the access topic, 3 things bubbled up to the surface: that we have a challenge with long waiting lists, especially with infants and toddlers, that families experience care to be too expensive, and that families need more information about how to find care and also what quality care should look like. In our quality domain, we talked a little bit about how our QRS system is voluntary and inconsistently understood, both across families and providers, and what it means and how we interpret that in terms of the types of programs that we have. That centers consistently report staffing and facilities barriers to improving quality, and that we have inconsistent partnership and collaboration approaches. Now, this was something that was really fun in the last listening session, because this finding in particular, what we saw was that there are some places that are really doing some novel partnership approaches in how they think about providing care for families by hours, by sharing spaces, by sharing resources, by sharing information. But it's not necessarily systematic. And so it could provide a really unique opportunity for us to think about building on those partnerships. And we'll be talking about that more a little bit later, and even in the strategic planning session next week. The last bucket of information is about workforce and professional development. And 2 themes really surfaced from those: that we have staffing challenges overall, but that those staffing challenges are greater in rural areas where it's harder to recruit folks to come and to stay. And that providers need support for training, not just training where they're at, but also career advancement, to really think about how we can make the early childhood profession a profession for folks that can see a future in where they're going. So now I'm going to summarize a little bit from Data Dives 1 and 2, and then I'm going to pass the baton to my partner, Dr. Dorius, who's going to share with you about access, quality, and workforce. So Data Dives 1 and 2 had a lot of the integrated data system work shared. So we were really trying to understand, back to the beginning of the presentation, what are those unduplicated counts of children across our program? Who are we missing in our programs? Where are there pockets of children who are not connected? So with the integrated data system, as we pulled together birth records and kindergarten enrollment records, we had our first data point just with the match, where we could take a look for the first time, to our knowledge, children born in the state of Iowa who attend kindergarten in the state of Iowa. And there's two data points here that are of importance. So when we think about kiddos born here, only 69% of those born in Iowa stay here through kindergarten. But on the flip side, when we look at the population of children in kindergarten, 78% of those were born in Iowa. So just to summarize a little bit of that, basically what this is sharing with us is that more children are born here and leave Iowa than who move here between birth and kindergarten. So it just provided us an interesting perspective to understand who's in our system and who's born here and stays throughout kindergarten. The next piece of information, we integrated data from our Child Care Assistance Program, from our Department of Education preschool programs, and this includes statewide voluntary, shared visions, and early intervention for children with special needs. And we also integrated the Teaching Strategies Gold assessment data, which includes some additional pieces of information for families who may not be in a Department of Education funded program. And we pulled all that together to try to get, for the first time, that understanding of unduplicated counts of kids in programs. By taking a look at whether or not a child had any of the above, we were able to find out that about 73% of this cohort had one or more of those above experiences. So whereas before we could only look within a silo and say, what do our children who are in child care assistance look like? Or what do the children who are receiving, who are participating in Department of Education funded programs? Now we could see those across systems. And now I'm going to show with you a diagram that I don't expect anyone to read any of the numbers, but I just want to show you the extent of what's capable with this type of information so you can see how we're trying to understand program overlaps. So this is a Venn diagram. Like I said, it has got a lot of numbers and figures and overlaps, but the point of the diagram is to say, if you look on the left, the yellow bubble are all of the kids in Department of Education funded preschool programs. The red pinkish bubble on the right are kiddos who have a Teaching Strategies Gold assessment. And you see it's not a perfect overlap, right? There's kids that have a Gold assessment who weren't in a DE funded program. There's kids in a DE funded program that don't have a Gold assessment. And similarly, we have children who have a Child Care Assistance funded experience the year before kindergarten. Some of those also have a DE funded experience. Some of those also have a Gold experience, but there's pockets that do not. And so this kind of a diagram is able to show us the different characteristics of children who have different types of experiences. And we can take this diagram to a whole other level now, also by looking at characteristics of those children and families and what do we know about them and what are their outcomes and how do we understand service patterns and gaps. So we have lots of overlaps. If I was going to summarize without any numbers, we have lots of overlaps in our system that complicates our understanding of unduplicated counts, but now we have a way to look at it. So we took that Venn diagram and we took all of the data behind it and did a lot more analyses than we're going to share with you, but I wanted to summarize what we learned from that, because the fun thing about the learning sessions was that we shared some information, we went back and redigested, and we just shared some more information and we went back and redigested. And here's a summary of 3 main points we want to show. So first of all, one of the things we identified was that children in rural areas have more cumulative risks. I'm going to show you a picture of this in a moment, so let's come back to that. We also found that some children are less likely to have a preschool experience. Now, when I say preschool, I mean any type of experience, whether that's DE funded, DHS funded, private funded, any way we were able to capture a preschool experience. Children born to moms without a high school education, born to single moms, born to children with inadequate prenatal care, and children in urban areas were less likely to have a preschool experience the year before kindergarten. We also found that some children are more likely to receive a child care subsidy. Our minority children, children in poverty, children born to single moms, and children born to teen moms. So this was some interesting information as we look at the overlap in all of our programs and services, where we can start to uncover where some of our underserved and vulnerable populations may be. Just to share with you a picture of what we did with the cumulative risks, what we did was we took those indicators that we were able to capture at birth. So on birth records, we're able to understand things like family was living in poverty, mom had education level below high school, children born to a teen mom, children born to a single mom, children with inadequate prenatal care, born with preterm or low birth weight, and children whose moms indicated they smoked during pregnancy. We added all of those risks up, so it was basically a sum of 1 to 7. And what you see here are pie charts representing that cumulative risk for all Iowa children on the left and rural Iowa children on the right. So on the left, for example, you see for across the state, 41% of children have none of those risks. But if we focus on our rural children, only 33% have none. We have a lot more children with multiple risks in the rural pie chart. If you add up the 3 or more and the 2 or more, we have 46% of children living in our 88 rural counties that experience 2 or more of those risks that we can identify at birth. And when we looked at some other analyses, we're not going to show you some graphics of those, but when we look at the relationships between cumulative risk and some of our kindergarten outcomes, we know how big of an impact this has. And we can identify some of these at birth, so we can see some of those trajectories. And it gives us points to think about how we could intervene or how we could think about strategically addressing some of these needs for our rural kiddos. So now I'm going to pass the baton to Dr. Dorius, who's going to talk with you about access to care.
That's great. Do we want to take a moment now or wait till the end on Q&A for your early stuff?
I think maybe just keep going. Do we have?
Yep, that's great.
Okay.
All right. Well, so in addition to just thinking broadly, I think one of the really extraordinary things that we were able to look at was this unduplicated counts that Heather mentioned. But there was also we were able to gain real leverage and insights into other aspects that matter a lot to Iowans and to families within the ECI system. And so for Data Dive 3, we're going to focus on access to care. And this we'll take information from the survey of ECI families, the provider survey of licensed center-based childcare, and then the focus groups of families. And we really focused on how can we improve knowledge and coverage of service, and can we reduce these barriers to access. So kind of the big takeaways that we'll work through, and I'll show you some more examples in a minute, is that communities identify a lack of childcare as one of the top 5 most pressing issues. So I'll show a graphic of this again, and as a professor, I know with pedagogy that we often say you have to hear things numerous times for them to sink in. So we will say this 3 times in this presentation, just how important this is, that across the state, communities said childcare is what matters, and this should be driving our priorities, both at the state level and at the local level. We also learned that families identified the biggest barriers to care were waiting lists and costs. And infant and toddler programs both have waiting lists, and those are that's especially true of the infant toddler area. Now, the size of the waiting list is something that we looked into quite a bit, and it happens to be about 1/2 to 3/4 the size of enrollment list. So what that means is if you have 100 children who are in your program, then we would expect you to have a waiting list of between 50 and 75 children to get into your program. So we have quite extensive waiting lists throughout the state in our licensed childcare centers. Now, this kind of interesting tidbit, we're going to dive into this in just a minute, is that even though waiting lists are long and most centers have them, the majority of centers with waiting lists actually are operating at below capacity. And we have a lot of good reasons for that we'll share. In terms of access to care being based in knowledge, like one of the ways that we can have access to care is that we know about that care. And our family survey provided information to show there is widespread knowledge of Medicaid, ECE, and child care services. There's also access to computing support in terms of 99% coverage of smartphones and about 85% for both computers and tablets. So I want to take just a minute and think about these community listening sessions that we did. One thing that we learned here, oh, excuse me, let me go back. I'm trying to, there we go. Okay, the community listening sessions. So you've seen this picture before. These are the 20 extension regions in the state. And over 1,200 community members were interviewed as part of this process, and they were asked, what do you think are the most pressing issues that are facing your community? And they had a nice discussion about all of those issues. And at the end, they said, okay, now you need to choose your top 5 most pressing issues. And the top 5 most pressing issues that came out in 19 of the 20 counties, childcare was one of those top 5 issues. So this is something that community members across the board are recognizing as a real issue and a real concern through all the areas and regions in Iowa. In addition to this notion of access to care, about half of these regions put in their list of striking community concerns was the affordability of care and the quality of care. And one thing that many community leaders and participants noted was that the fact that we have access to care problems here means that there are ripple effects in workforce, both employment opportunities and in housing stability. And so when people are trying to build and sustain their small rural communities, they know that childcare is an important issue in thinking about these long-term strategies. The next one that we're going to talk about is the barriers to service. So families were asked directly, what's made it difficult for you to use services designed for families like yours? And over half of the families who participated said waiting lists made it very difficult. About a third, it was costs. And then we had around 20% that it didn't meet their needs or there were transportation. And we're going to see these same issues reiterated in the focus groups as well. That there are these really specific and ongoing problems related to both waiting lists and costs. And so some of the quotes that we received, in this family survey, we gave an open-ended question that said, oh, would you like to tell us more? And I can say we've been fielding surveys for a long, long time, and I have never seen a response like this in surveys, meaning that families just said, yes, I would like to tell you more. I would like to tell you how much the waiting list hurts my family, what a hassle it is, how it made me, some people are saying I had to quit my job because of this, or I had to move back home and have family support take care of it. So these issues that it costs too much, that the wait is too long, but people feel that they should qualify for support, but they don't, either because of their special needs, multiple children, things like that. And then there was a real concern around transportation, that work schedules don't map on nicely to the childcare that's available. And that's especially true in rural areas that have higher levels of non-standard work. Another thing that the provider survey taught us in terms of access to care is that, these waiting lists that families note, providers note them too. So when we look across the different, the 518 preschool providers and the 311 infant toddler providers, we see that the majority, about half of preschool and 78% of infant toddlers, have a waiting list. And here's the number broken down that we talked about before. When you say what percentage is that of your current enrollment, meaning if you have 100 kids, well then we would expect to have 77 infant toddler families with infants and toddlers on the waiting list. And about the waiting list would be 40 for every 100 kids in preschool. Now, the thing that I think surprises people who aren't maybe as well informed in the ECI, and I know when I moved into this area, this was something that was something that really puzzled me until we provide some of the data we'll show just a minute, and that is that centers with wait lists are not enrolled at capacity. In fact, we have more than half of both the infant toddler and the preschool say, we have these long waiting lists, but we are not maximizing the number of children. And these waiting lists are longer in urban areas versus rural areas. But we want to talk about why those waiting lists, why they're not at maximum capacity. So of these 57% of centers that say they are not enrolled at their licensed capacity, a big reason is they're unable to hire staff. And that's twice as big of a problem in rural areas compared to urban areas. There's also these issues that there's lack of demand for slots. Now, when we break this out by which ones are for preschool and which ones are for the infant toddlers, we see that the lack of demand is more often in this preschool area. And then there are other concerns, which we'll dive into in just a minute. Now, when we look at this by those children who are funded through CCA, so these are some of our more vulnerable children, and these are the centers that provide the CCA support. That inability to hire staff is a much larger problem in our CCA-funded centers. And the lack of demand for slots is a lower problem. In fact, the non-CCA-funded centers, that is the bigger issue. And then there are other issues as well. Some of those issues include well, we'll get to those in the next data dive when we talk about quality, but this is really going to be people care about quality. And so that's one of the reasons. We'll come back and give you more examples of that in just a minute. Now, from the family survey, when we talked to lots of people at those listening sessions and we held these, the July and August groups, this was something that really stuck out to people. So I want to pause here and share that this is something that was probably one of the big findings from the family survey, and that was, when you are in a time of crisis, where do you go for help? And people could choose any of these options that you see. And we see that almost everyone universally in a time of crisis turns to a close family member or friend. And then there are lots of other places that they turn. But all in all, when we think about and synthesize this information, what we see is that families turn to trusted people and not technology or media when they're in crisis. And this provides us some really valuable information when we are thinking about our communication strategies. And it also tells us we need to think more broadly than just the families that are in ECI, but whole communities. What do we need to tell Iowans about the problems in childcare, or how to solve, how to address your issues, and where to turn for help as it relates to the ECI system? We also did these great survey and focus groups. And some of the big themes that came out here were, again, waiting lists and costs are significant barriers to access. You've seen information on that. But in the qualitative, this rich qualitative data where people wrote in and added additional things, or in the focus groups where we really drilled down on what they meant and thought, we found that there were some additional issues that are worth mentioning. Transportation was one of the biggest issues that came up. And this was especially true for people that had, because of a lack of access, they might have their children across multiple providers, or they might have early care in one area and after school care in another. Some people were traveling to multiple counties to get care across their children. So one child might be in County A and another child might be in County B. And across all of these complicated access to care issues, it created equally complicated transportation issues for our families. And so this is something that is tied, again, both to workforce and to housing stability, as we're thinking about the transportation as a key component of access. Another issue that came up regularly was this need for wraparound care. That some people might have access to care for a part of the day, but not for the entire time that they work. And that this is something that we really need to address, especially in our rural communities. Again, an issue that was particularly strong among rural families, but was mentioned by lots of groups, was that non-standard work hours create additional barriers to care. So if you're not working in the traditional 9 to 5 range, it is very difficult. You have an additional burden on top of access. You have an additional burden to find places that can help provide for you and your family. And then there was noted, and this was in the community sessions, the focus groups, and the surveys, that we need more attention paid to special needs, trauma-informed care, and refugee services. But these are all issues that we need to be ready to tackle within our system. And kind of one of these sad but important takeaways that we learn from these focus groups and the surveys is parents have reported multiple times that they feel uncomfortable with the care that they're receiving. And that's often because they're going to providers that have low quality or unlicensed, but they feel that they must do that if they want to keep their jobs. And so people are really in a bind. And so they might be accessing some sort of care, but it's definitely not the care that they would really like. So in our next data dive on quality of care, we're going to look through 4 of these different data elements to try and figure out, do families believe that the programs meet their needs? And how can programs collaborate more effectively? Because we know one of the ways to improve the quality of care is to improve the net value of care that's across all of the services received. So some of the big takeaways that came both from the data and then from all this expert advice that we learned in these sessions in July and in August were that families say that quality is moot when they don't have access to care. So back to that issue that families are saying that they're using care that they feel uncomfortable with. They're doing that because they need to in order to keep their employment. And they would love to make quality a top concern, but they can't because access is such a barrier. We find that programs for low-income and vulnerable children are both lower quality in terms of their QRS rating and have less qualified staff in terms of their education and training. Providers report barriers to quality that are both staffing and facility concerns. providers report that there's lots of levels of collaboration, but because of paperwork and privacy concerns, it really limits their capability to effectively work together to improve quality across the system. And budget challenges have limited capacity and hurt provider morale. So we kind of set this up a minute ago when we said, why are there all of these people on waiting lists and yet centers aren't at max capacity? And here's kind of the answer to that question. So of the 55% of centers that say they don't participate in QRS, I'm sorry, I'm jumping ahead a little bit. This is tied to it. Of the 55% of centers who report they don't participate in QRS, the reason for that is either it's not required, the fact that it's voluntary, and this became a big issue when we talked to the experts in our July sessions. Cost barriers, that maybe they're in process trying to figure this out. You can see there were food requirements, time constraints, staffing barriers, or other accreditation issues that were quite significant in saying, why don't we have this mandatory level of quality of care? In terms of facilities concerns, 41% of the providers who responded to the survey, and I will again just pause and say, this was a very representative sample of providers throughout the state, and 41% of them said they had facilities concerns. And you can see what these concerns are. The largest concerns, over half of them, had concerns about their outdoor environment, and about half had concerns about their indoor environment in terms of providing the opportunity for gross motor skill development. Classroom size, kitchen, sufficient lighting, ventilation, toilet and diapering services, safe storage, sufficient dining space, or actual hazards, all rated on issues that were of concern to providers who were actively providing care for children and families in Iowa. Now, many of our programs are doing extraordinary things with their collaborations, and we find that they have partnerships with other programs. They might be sharing space, they might be sharing staff, and they might be innovating in all sorts of ways that we've just learned the strength of many of these programs in terms of their partnerships. And when we think about how we might leverage some of these strengths and partnerships in the future, that's what really this table means for me. So in terms of the statewide voluntary preschool program, 38% of our rural centers have partnerships with other programs, and that's a little less likely to happen in urban areas. Same thing with shared vision. Rural centers are slightly more likely to have partnerships with other programs. In Head Start, that's the case, and in the child and adult care food program. So what we see is across the board, whether and likely out of necessity, is that rural programs have really figured out new and innovative ways to partner. And that's a strength that we need to think about leveraging in the future. So when we look over the survey and focus group themes that came up over this time and just what were the qualitative findings, what could we add to this? You know, one of the things that providers said that came out as just terribly important is that they have to collaborate. The nature of their job is they must collaborate. And they may choose to collaborate more often than not, but they collaborate on referrals and on professional development training. But the issue of universal applications and forms and waivers make it difficult for them to serve children in a holistic way and to provide services at these key transition points, both in the day and between services in a child's life. And so some of the feedback that we received was, we just need to make sure those dots are connected. You know, how do we get the child from the early care program to the after school program? And how do we help them transition from this early care program into kindergarten or between a DHS service and a Department of Public Health service? So connecting those dots was something that came out over and over again. Providers in their focus group had some really wonderful ideas around this idea that there might be real opportunities to strengthen communications between programs. So programs understand, not just between, but two programs, so they better understand what they're allowed to do in terms of partnership and collaboration and how they can do it, especially in the context of policies that are currently in place and the fact that many of these policies change over time. So there was a shout out for additional training to please help them better understand how they can leverage their own expertise and work within their community with other partners to build the services that children and families need. Now, this one might not be a surprise, but it's important to mention because it was important to our families and it was important to our providers and it was a persistent theme that emerged. And that is that budget challenges have made things more difficult. They've reduced services, programs, and staffing levels, and they've taken a toll on the morale of service providers. And one of the quotes that I think really made sense to a lot of the people that we've shared this with is, if we're overwhelmed, we know parents are. That even our providers are at this place, at this time and place where they feel overwhelmed by what they're asked to do as the resources dry up. Okay, we're going to jump into the last data dive, and then we'll open it up for questions. I see in the chat that a lot of you are popping up some very excellent questions. We look forward to getting to those. But we want to provide a little bit more information for those people who need to take off a little bit early. So Data Dive 5 really focused on workforce and professional development. And the key question we asked are, what are the most pressing workforce challenges for ECI and early childhood education? And does education and provider retention differ between rural and urban centers, or those that take CCA and those that do not? So kind of the overall summary of what we're learning and thinking about is that the college curriculum for EC providers is aligned, but the majority of providers don't have college degrees. And so we need to think about new and better ways to meet people where they are and ensure that all providers have access to the curriculum they need and not just the college-educated providers. Also, providers again report barriers in recruiting and retaining staff, and providers have asked directly for a clear career pathway so that they can make early childhood a profession. We have people that are committed to children, that care deeply about children and families in Iowa, and who are troubled by the fact that it would be more beneficial for them and their own family if they were to quit their job within the early childhood area and go work for Hy-Vee. It would be better hours and it would be better pay. So that's one of these issues that came up that we really need to be thinking about, is how can we engage with the people who care and who are committed to providing the services they have to have both more education and a better career pathway. Now, when we think about education, we want to show you what the education breakdowns look like across these different kinds of programs. And so each bar represents a different type of program. So the blue bar is overall. So across all of the programs, what does it look like? And so we'll just take a pause and say, okay, so across all of the programs, 4% of the providers have less than a high school education, 7% have a graduate degree or more, and most are somewhere in the middle with either a high school degree, some college, or a bachelor's degree. Now, in terms of the CCA providers, those are the orange bars. What we see is this distribution is very much centered on the lower education and the high school. And then there's some college, but by the time you get to a bachelor's degree or higher, those numbers really dive down. So we see that the CCA providers, the orange bar, compared to the overall of all providers in the state, the blue bar, have lower levels of education overall. When we look at that by rural centers and providers, and those are the green bars, we can see sort of a similar story. This matches more with the overall, except that we see that our rural providers are more likely to have a high school degree and less likely than the overall centers to have a bachelor's degree or a graduate degree. And then in our urban areas, the urban areas, excuse me, the urban areas do report that the providers in urban centers are much more likely actually to have a bachelor's degree and some college. So education levels differ. They're higher in centers that don't take CCA, even if you remove all of the preschools and just look at the centers broadly, and rural centers have a less educated workforce. So those are our two big takeaways in terms of education and training. So when we say that even though our college curriculums are, they're great, they're aligned, they're doing it all, when we look at these rates and say, okay, well, that is only speaking to, at most, a little over a third of the people who are in these centers. What does that mean for our need to improve workforce development for the vast majority of our providers? In addition to education, an important issue that's driving quality is the retention of providers and teachers. So the percent of teachers retained for at least a year in these centers, overall, 84% of centers are able to retain their teachers for 12 months or more. But that's only 77% in the CCA, among CCA providers. It is much higher among rural providers, and it's much less among urban providers. So this is a little interesting twist. What we find is, although the rural providers are much less educated, they actually will stay at their job longer. And although urban providers are more educated, they have more of a revolving door in and out of service provision. In terms of our survey and focus group themes, what we find is provider pay and benefits are a challenge for retention. Providers want and need more training in mental health and special needs. They see that that's a need. You know, we talked about it, came up in the community and it came up in the family surveys that we want more refugee-specific needs, we want more special needs, we want trauma-informed care. Providers see that as well, and they're also asking for that additional support. We see that there's a twofold workforce problem. There's insufficient and lower quality workforce in the childcare field, and that moms and then caregivers generally are limited in their ability to be in the workforce because of childcare challenges for their own families. And at the community level, this is something that is really worrying our community leaders, because how do you sustain a strong community when you can't sustain a vibrant workforce and you can't support the average family in your area?
Great. Well, thank you. We're going to back up here and take some time for questions. But before we do, I just wanted to provide, get ahead of yourself. Wanted to provide you a roadmap for where we're going. Speaking of getting ahead of yourself, just to stay tuned to what's coming next, we're going to be taking all of these data and findings and preparing them into a comprehensive report to send in for our federal requirements, and to also really capture all of the information that we've shared today and through all of the learning sessions. We're also working on, as a core team, the strategic plan revision with lots of input from stakeholders. For those of you that are able to join the upcoming webinar on August 13th, I believe that's next Tuesday, you'll hear more about that. In the first week of September, we're going to be working with the State Board and Stakeholder Alliance to review and adopt these revised needs assessments and plans so that we can send them in to our federal partners for review and approval, and then work toward our next federal request for funding to advance our strategic plan. So, you know, the hope and the idea is that the findings from this needs assessment are really helping drive ECI's ultimate mission to ensure all children are healthy and ready to succeed starting at birth. And so we're looking forward to some of those next steps in our marathon. And just a little shout out, if any of you want more information, you can obviously go to the Early Childhood Iowa website. There's a specific place there where preschool development grant information is being shared. And you'll also see information about who all, this is the brought to you by page. And if I could include 5 other pages of all of the other people who have made this happen, we will definitely be doing that in the comprehensive needs assessment. So to back up a little bit, let me now pull up, and I'm going to turn the mic over to Kelly, who is going to help moderate some questions for us, so we can facilitate some Q&A, and please feel free to jump in. So let me turn it over to Kelly.
So folks, I think if you would like to ask any questions of our presenters, you are more than welcome to do so. We had a few questions come in from the group chat that we have tried to provide some responses to throughout. But I would definitely welcome any questions and help read those out to our presenters. If you want to go ahead and type those into the group chat, we can facilitate it that way. I'm going to assume everyone is thoughtfully considering their question and typing furiously into the group chat. So we'll give it a couple more minutes. But folks, this is definitely your opportunity to take advantage of the expertise of our Iowa State team. So I really encourage you to ask any questions that maybe floated through your mind as you were viewing the slides. As you're typing, I will also share that we're planning to have some of this information available on our preschool development link that's also been provided in the group chat. So we've been trying to record this webinar, and we also will have lots more forthcoming documents that we'll be able to share with the group, so you can refer back to slides and tables and all the beautiful charts that they put together.
One of the things that's been really, I guess if we've got a few minutes, one of the things that's been really fun, I think, for our core team and throughout the July and now early August learning sessions is how we've created opportunities to really wrestle with the data. And so we also wanted to acknowledge that this is not going to be a 1 hour fully digested understanding of what's happening, right? And that we acknowledge that. We hope that folks will see this as the first part of a conversation that will continue as we hope to continue to learn about the system and even just learn about how we can collect new and helpful information, both from the integrated data system, for our focus group approaches and our family survey approaches, and just continue to really learn and inform our strategic planning moving forward.
We did have a question come in. This is from Cindy D. Has a question about the turnover / longevity of childcare teachers in rural areas. We are seeing 50% turnover or more. So if either of you would like to speak to that, that'd be great.
Yeah, that's a really tough one. And we struggled with how to actually analyze these data because, as we said, I mean, we collected a survey of providers, and what we asked, we tried to keep the survey short so that we could make sure we got folks who could respond in 15 minutes to provide information about what's happening. And the way we asked the question in our family survey was about what % of your teachers are you able to retain for 12 months or more? So it was a different frame on the question, I think, that Cindy, that you're bringing up, which is about the 50% of your teachers turn over each year. That is probably also a very real phenomenon that's happening. And so I think you're right. I think we need to wrestle with that a little bit more and really figure out what can we learn about how to support staff and how to support centers in those kinds of environments. One of the things we've been talking about in our strategic planning discussions is really around what can we learn from some of those really well-working partnerships that we know exist, where folks are able to retain staff. And I think where we think about opportunities to identify almost like shining star centers, right? Where are our centers that are able to retain, and what are they doing uniquely so we can learn from that? So I think that would be one of our important next steps, but I think you're exactly right. There is a challenge in retention for sure.
And one thing that we might be seeing, I think there might be a couple issues as well. And one is, as Heather mentioned, that when the providers answered the question generally, they might have had in mind, their full-time teaching staff. And then perhaps some people, when they're thinking about turnover, might be thinking about like the student aides who come in and support. And so the clarity around that is something that we've thought about developing into the future. And this is also just aggregate. So when we look across all of the rural areas, these are the numbers that we're seeing, that 89% retention. That doesn't mean that some of those centers don't have very low retention rates, and some of them have much better retention rates. And this is only the average, but I found that a kind of puzzling and interesting thing as well. What I can say again, and which we go back to regularly, is this was really a representative sample. We represented people in 93 of the 99 counties. We didn't. The providers themselves represented themselves, and it was quite reflective across the board, both of the QRS ratings and of just generally whether it was a preschool or infant toddler. And so it was a very wide breadth of ideas that came here.
We have 2 other questions. I'll start with the first one. Oh, we have 3. Okay. I will start with the next one. This is from Lisa, and she says she'd be curious to know if the turnover rate we're seeing in early childhood differs significantly from turnover in other disciplines. I know the low unemployment rate, it seems retention is hitting all industries pretty hard right now. So I'll see if you 2 have anything to add to that.
Yes, Lisa, that's a fabulous question. I definitely don't have an answer to that one, but we will add it to the running list of things that we will see what we can look into.
That's kind of been the fun part about this, is that for any of you that like to ask questions, as soon as you answer one, there's 6 more. And that's really exciting. But that is a really important one, to truly try to understand. We've had such a focus on early childhood. And even, again, just to preface, our focus with this needs assessment was a lot on the transition between pre-K and kindergarten. So we also know we have a lot of work to do to really understand the entire birth to 5, right? Some of the information we shared captured that, but we really need to continue to look more comprehensively to try to answer questions just like that, Lisa. So that's a great one to add to the list. Yes.
So I've written it down. I agree. Great question. And we could only speculate at this point, but I would say some information that's kind of around the edges that addresses this is when we look at the rural communities versus the urban communities, we see that the rural communities are better able to retain their workforce. In this data, what came out in our provider survey. And what we know from other literature is that is a workforce that has more difficult time finding and maintaining jobs. And so there is likely something going on there. It wasn't a direct focus of our project, but it would be worthy of additional future attention. And we do have some side information that lets me think you're probably onto something. And I bet that would be a fruitful path if we were to follow it.
All right. So the next question that came in is from Erin. And Erin says, are we going to take the information from the needs assessment to make decisions about what services are going to be offered in the future? Iowa has a workforce registry that tracks ongoing PD and pre-service training and the workforce in centers/homes as a whole. Will we use that system to gain insight about baseline and progress? Iowa has an ECE pathway. Do you think we need to make adjustments to that to be more helpful to the workforce? And then there's a side note saying, very exciting and wonderful information, and thank you so much. So maybe I'll let you two start, and if there's a place that I can jump in and support that around the decision-making.
That's actually what I was going to say, was that I think Kelly would be great to answer that. This is,
okay.
And I think somebody told Erin to ask that question, right? That was very, very well placed. Yes.
That is a wonderful lead-in and a great opportunity for us to tout our next webinar on the 13th. But to answer your question directly, absolutely. The information from the needs assessment has been the foundation for how we have looked at updating our strategic plan going forward. And so we took this new learning and use that as a lens to think about what our current strategic goals are, our current strategies, and all of the action items that are in the plan as it stands, and think about areas where we need to have more concrete action, where we need to fill gaps. And that has definitely included professional development. In fact, our team was sequestered in a room yesterday working on a professional development goal. So the things that you're mentioning are all top of mind as we're thinking about how to craft a really good goal around professional development. And while we're still in the drafting and sort of assembly and revision phase, we will be presenting an overview of what that goal looks like for you on Tuesday. So I would love it if you could join us to learn more about what we're thinking around professional development. And I'll also just add a plug that Tuesday is an opportunity for conversation just the way that this is. And it's an opportunity for your thoughts and reactions and feedback. And so as we present sort of the draft strategic goals and strategies and action items, we definitely want to hear from you about whether or not we're on the right track, or if we need to add more or be thinking about something in a slightly different light. So I'll stop there. Mm-hmm. Cass and Heather, do you have anything else to add to that?
Yeah, I think you did a great job. I mean, I think the overarching question is, yes, we're hoping to use the information from the needs assessment. And I guess, too, just the plug of use the information now with the continued understanding that we're not going to stop analyzing these data and thinking moving forward. This was not a one-shot deal. This was just a first step. So where we can continue to learn and continue to ask questions. We've built some really cool capacities now to ask and answer more questions about our system, and we hope to continue to do that.
All right, we have one more question, and this is from Marion. Marion says the federal poverty rate for Iowa children in 2017 was 12.6%, but our data showed 49% eligible for Medicaid or WIC at birth. Do these programs have higher income levels?
Yes. Short answer, yes. Long answer, yes. I mean, what we did and the good and the bad about administrative data is that the administrative data that we're working with captures variables that are relevant for the systems that they come from, right? So public health is going to collect information one way, and when we're trying to understand poverty at birth, the best indicators we have for the entire birth population is whether or not they qualified for Medicaid or WIC at birth. So you're exactly right. Those qualifications are higher than the strict 100% federal poverty line. But it's the closest indicator we can get for that birth cohort to say, likely this family is in the bucket of poverty threshold, may not be right at 100%, but somewhere between 100, 200, 300. I couldn't spike the exact numbers for you, but we can look that up, Marion. So you have that information for the future, but they are higher for those two programs. That's correct.
And there's also an issue here of somewhat comparing apples to oranges, both in terms of what the requirements are to qualify, as Heather mentioned, but also in terms of the population you're referring to. Mm-hmm. So those federal poverty levels might be for all children under 18 or children under 6 or children under 5, depending on which program you're pulling the information from. And we were presenting data on the children born in the state in a particular, mostly an 18-month range, who are eligible for kindergarten in fiscal or academic year 17-18. So we had a very specific population, and we were looking for poverty within this very specific population and not among all children as a whole, especially among the age ranges that are probably documented in the rates that you're sharing.
Good question.
Yeah. You regularly bring up the census. Good work. Thank you, Marion. As a demographer, I appreciate you very much.
All right, what other questions do you have for Cass and Heather?
Were there any questions? So how about if we ask you a question? Not a quiz, but a question.
Oh, there's a quiz.
What kinds of questions didn't we answer? So given the information that we did share, was there anything in there that you thought like, oh, why didn't they ask this question? Or could you look at the data this way? Or what about this population? We are also collecting our parking lot of those, and it's not actually a parking lot because everything continues to move, but where we could continue to look at some of that information. So if you have ideas or other pressing questions that we could think about looking into the data for, please also share those. We might not be able to answer them today, but share those with us.
And as we're also thinking about the renewal, Heather mentioned that this is one step into the renewal process where we will hopefully get additional funds to pursue the priorities that came out of this process. What are things that should be part of that? What additional, there are gaps. We've tried to fill a lot of gaps, but there are still gaps. And what are the gaps that are really critical to you in your work? I get this in classes too, and then I start calling them.
I have a question.
Just kidding.
They're just typing. There is a question here. Was there an opportunity in the data collection phase that would have asked participants about their experience or involvement with early childhood Iowa?
Yeah, that's a good question.
So we did ask about if they'd ever, what did they know about, and had they ever accessed services across the ECI system? But not about, I'm not sure what this means, but not about like specifically being involved with ECI as a bureaucratic structure.
Yeah.
But that could be really interesting, especially as we're looking to get that bidirectional flow of information between families and ECI.
Something that I'm going to go a slight tangent, but it's related, I think. One of the things that was fun in the learning sessions and strategic planning was to think about what were some of the sub-themes that came out of discussions, right? So data can point to something. But then there's all the sub-themes of what conversations does that raise and what other anecdotal information does that draw out. And as we were thinking about some of the findings around what information families have and what information even centers have and what information might be confusing, this is something that has come up, is like the how do we think about communicating what ECI is?
Yeah.
Who is ECI? I mean, as we think about ECI as the system, how do we engage with folks and how do they recognize the role and the place that ECI plays in the connection? So I think that's a really good point, and really trying to understand how where ECI's role is and how folks are understanding that would be a really good question.
There's a follow-up comment related to that question. Just saying, yes, because ECI funded services is often how families are able to access or use the part day, part year DE funded preschool experiences. All right, let me scroll up and catch a few other questions. There was a question in here about inclusion of family childcare providers. Thinking that this was perhaps not included in the data collection. I'm sorry, the screen's moving on me.
We have lots of
ECI with children, especially infants, toddlers that are being cared for in home-based care. And it looks like we have some follow-up already from Chanel to clarify that they were included in the focus groups, but we were not able to conduct a survey specifically to that audience this round. I would field that back to you two to see if you have anything else to add about our efforts to reach that group.
Yeah, that was definitely something we considered and tried to think about. I mean, I think even back in the original core team discussions about where are we going to focus and how are we going to think about our first step as the first 6 months, and then what will we do next? And so, that I think, as Chanel said, we wanted to make sure their voices were included in the focus groups. And I think we're anticipating that we would really love to try to circle back with that group in a following round and see how we can't gather more information in more of maybe a survey format in the future.
Yeah, it was definitely an issue that came up multiple times. And similarly, this will sound, I think, a little bit like a tangent, but it relates to this issue of representativeness and equity in terms of whose voices did we listen to and did we hear. And so I just want to pause for a minute and focus back on the data that was collected. So for these provider focus groups and for the family focus groups, this was actually a really interesting and representative sample in some unique ways. And so these provider focus groups were put in, regional areas were chosen, and the ECI directors helped to get people across the system, not necessarily just ECI funded programs, but services that were provided to young children and their families so that we could have this holistic view, both the dental and health related things, not just as preschool services, but what were they across the board with food support and nutrition and housing and lots of different issues that impact young families. So that issue of breadth was really a focus of the focus groups and the provider focus groups. And the same thing was true of the family focus groups. So the majority of those, 9 of the 13 that we reported on here, and some additional ones have been being done, the majority of those were general. So that was to be a wide variety of families who access services for young children and their families. But we had 4 of the focus groups that were for vulnerable populations. So they looked at immigrant families. There were 2 immigrant family populations. One was for Latino and one was for non-Latino. One was for single fathers. And then we had one for children with special needs. And so we really wanted to get to these vulnerable and underserved populations and get their voices a little more clearly. Similarly, in the family survey, Heather mentioned this, but I just want to reiterate it again. The family survey was an oversample, an overrepresentation of families who have children with special needs so that we could really target and think about that vulnerable population. And then the provider focus groups and the family survey both did a really excellent job of spreading between rural and urban areas, and so we could get that representation there. So when we think about what vulnerable and underserved means, and we started with one of those definitions, the way that we tried to build representative samples across all of these data collection efforts were to really hone in and think about not just the system as a whole, but these vulnerable children, and not just the system in terms of who's funded by ECI, but what are those collection of services that impact young children and their families.
Two good points, I think.
Oh,
moving forward.
we would love that. We've talked about it a ton.
Moving forward, those are two important ones. You know, and to think about too, we've been working together with Department of Public Health and Department of Human Services and FADS to think about how we can learn more about our home visiting programs as well. So we've got our home visiting programs, our home child care providers. There's definitely a group of folks that we will want to definitely target in some future iterations.
And I think it's very likely that would end up in the renewal. So I appreciate that feedback.
Mm-hmm.
Okay, we do have a couple of other comments, questions, suggestions. The first one is related to whether or not we used information about ECI scholarships and wraparound programs that are offered in the state. We may want to consider that as well. There are services that are being offered that weren't included, but maybe you already considered that.
Mm-hmm.
So I'll let you two speak to that.
Yeah, no, that's a good point. I think there's we will add that to the list of those. I mean, from the aggregate perspective, you know, we definitely have reviewed programs that exist and where we have administrative data that collects information about them, and included folks that receive ECI scholarships and that provide wraparound services in those surveys and focus groups. But those will be, I think that's a great point. Those would be important services to try to fine-tune to learn a little bit more about in the future. That's a good idea.
Okay, the next, there's a couple of comments here from folks relating to efforts to educate Iowans about the importance of early childhood and how important that is, and similarly expressing the sentiment around funding and not being able to do the broad outreach that we would perhaps like to do, with the follow-up question there saying what strategies should be used to educate Iowans. I will see if you two want to answer that, if you'd like me to.
Mm-hmm. It's a very good leading question for strategic planning discussion.
It definitely is. We have been working fast and furiously on this particular topic as well, related to the strategic plan. We had a lot of really rich discussion over the last few sort of in-person stakeholder conversations about this very item and how critical that is as a really a foundational piece for reaching our bigger outcomes related goals for children and families. So you will be seeing a lot more in the webinar on Tuesday, previewing what we have crafted in terms of a goal and strategies. And I will just say that all of those items are really based on and should be reflective of the input we've gotten. So if you have specific ideas as well, you know, please feel free to reach out and share those, you know, either today or as a follow-up as well, or join the conversation on Tuesday, and we will get your feedback more on what we're thinking already about communicating the value of early childhood. That's definitely a priority and something that we're working to craft concrete strategies and action steps around. Let's see, I have a couple of other questions in here. This one comes from Mary. She says, I see how this information provides data points for advocacy at all levels, local, state, and federal. It also relates to the National Workforce Development Initiative called Power to the Profession, or renamed as the Unified Framework for the Early Childhood Profession. Not sure if you have any thoughts or reactions to share on that input from Mary.
Yeah, no, I think that's great. And I think that's, there's a group of the core team plus members of steering committees and professional development work groups that have been really thinking about how to incorporate what we are learning and where we're going with some of that national workforce development work, and trying to frame, as you know, as Kelly keeps saying, please come back next Tuesday.
to the strategic planning discussion, because we're really trying to think about how we can incorporate workforce plans into that strategic planning effort that match some of this national work in terms of trying to ride on the themes and the momentum toward that, but also making an Iowa-specific approach that really fits what we need here. So thanks for that feedback. That's great.
We have just a couple of other feedback items, and I'm furiously writing down notes as we go through this too. Echoing support for power to the profession as a way to solve many of the questions around workforce definitions and professionalism. And then let's see, we also have another comment just echoing support for the need for broad-based public education, especially with businesses. We are definitely thinking about those things as well, and really look forward to continued feedback on that as we look forward to presenting our strategic plan on Tuesday. I believe we're scheduled to go until 11:30. So are there other questions or discussion items you want to raise with Heather and Cass from Iowa State?
I would just add, there was a question, an influx that happened kind of quickly, and one that we overlooked, but I would like to respond in case other people missed it, was Marion asked where this information can be available so he can share it with his local board. And Chanel responded that the PowerPoint will be shared from today on the website, and the actual needs assessment will be available on the website. So if other people are also interested in that, that will all be available on the ECI website.
It will be, and I think I shared a link to that section of the ECI website earlier on in the group chat, but I can pull that link over again and share. There.
And this is Amanda. I would also share that if you are not already signed up to receive updates through the website via the monthly musings, it comes out in a constantcontact.gov delivery message. Those messages go out the first Monday of every month, and we have updates in those as well for quick references for everyone.
This is Chanel. I'll just share that I just want to say thank you first to Heather and Cass for sharing about the needs assessment data and our process and how we it's evolving, and we're just beginning. And so anyway, it's been very exciting, as you guys could tell by the information. But I also want to thank all of you who were able to listen in today. At one point, I know we were a little over 50 people, and it's just it's a great mechanism to use this webinar to start spreading the word, and we'll continue to share in various ways, and we will also continue to figure out how to get more input from all of you and everyone else out there. We recognize the value of that, and that every time we got some information, we usually wanted more. So anyway, so I just want to give that shout out to everybody that's digesting this information. And if you have follow-up input or questions, feel free to send those. You could just send those to me right now. I don't think we know how to do that through our website. So just send that to me, and then we'll spread it out to the appropriate team members to make sure we're thinking about things as we move forward.
I don't see any further questions in the group chat. We could give it another minute and see if anyone has any lasting question or last minute questions, thoughts to share.
Well, thank you everyone for participating. Just some of the thoughts. I think we've been sharing pieces of this information starting with the core team in end of May,
And every time we talk about it, there's something new that comes up. And I think that also has reiterated for us as a core team about how valuable these kinds of conversations are. Data don't speak for themselves, right? Data don't walk, they don't have legs. They are only useful in dialogue with conversations with people who are working with the children and families that we're talking about. And so the more we continue to have this, and the more people say, wait, that doesn't make sense. How could that be? Or what about that? Or we missed this piece. You know, that really just adds so much richness to the conversation. So we really appreciate you taking 90 minutes of your time. We know you are very busy folks, and have just appreciated that opportunity to have those dialogues.
Absolutely. And we so value your expertise. You know, we can bring data that we've gathered from all of these different areas, and it's been so illuminating to have the boots on the ground experts telling us the way to reanalyze and think about it and to go back to the drawing board. So again, thank you very much. We feel deeply connected to the ECI system, and the, you know, Kelly's been saying the We Are ECI logo, and we definitely feel that we are ECI. We're part of the broad-based cross-sector, cross-disciplinary, cross-agency group that is ECI, and appreciate all of the feedback and expertise that you've helped teach us through this process as well.
All right, well, I just see a couple of comments saying a thank you back to you too. And so if that is all, I think we can go ahead and probably wrap up our webinar, and we'll look forward to seeing, hopefully most of you are able to join on Tuesday.
Excellent. Thanks, everyone.
Have a good Friday.
Thank you.